A warm welcome to everyone to World Voice Day program. Today we are here to celebrate World Voice Day where we are celebrating the voice which is an incredible instrument which we all possess. Voice is very important for communication as well as for expressing our emotions and feelings. However, there are certain factors which can impact the vocal health, such as which we will be discussing in this particular discussion. So, before we start with our discussion forum, let me welcome myself and my colleagues from Nitte Institute of Speech and Hearing, Nitte deemed to be University. I am Srushti Shabnam, Associate Professor. With me, I have Miss Akhila Rahul, Assistant Professor, and Miss Bennett, Assistant Professor. We all are dedicated speech language pathologists, where we serve individuals with communication disorders. So, without wasting any time, we will start our discussion to begin with what constitutes a voice disorder and who is the vulnerable to experiencing voice related issue. Ms. Akhila.
Yes. So voice disorders are very common. So we can see this problem in a lot of people, right from children to geriatric population. So we can say that when we say that a voice disorder is when somebody's pitch or loudness or the quality of their voice is slightly different, or it's different from what is supposed to be for their age or their gender, and even for the socio-economic backgrounds. So if a child who is supposed to have a childlike voice, um, but they have a slightly different, their quality is slightly altered, maybe it's like something that we say like a husky voice. If certain changes are seen in their voice, that's what is called as a voice disorders. So as I said, any group of people can get affected with voice, but to be very precise, it is a disorder that most often we see when we overuse our voice or misuse our voice. So naturally, people who tend to overuse or misuse their voice, they are going to be at a higher risk. So a child who may misuse by speaking excessively, or maybe a young adult, or anywhere, an adolescent or an adult who may be a professional singer, or maybe who's into using their voice, like a dubbing artist, a theater artist, or just a casual singer also. Very commonly, we see the problem even in teachers. So,
Okay.
any of them can be at risk. So, it is a disorder that we can see it on a range of population, to be precise.
Okay, great. So, what are the common reasons which can result in voice problems in across all these different age groups?
So, as Akila has already told, generally there are specific populations that are more at risk, like people who use their voice for their profession, like teachers, singers, actors. But if we see around us, a few of the most common reasons why a person might get a voice problem can be a common cold. You have a throat irritation, you are taking medications for it, but still you feel that no, the irritation is still there. My voice doesn't sound normal. So even if someone hears your voice over the call, they will say that is something wrong with you? Are you having a cold? So
Exactly.
things like that are very common. So maybe a common cold, or sometimes people who have respiratory problems like asthma or any of the bronchial disorders, they can have voice problems. It can also be seen in people who are more towards the hormonal range of disorders, like in cases of thyroid or any form of hormone related issue, endocrinal issues. You might also see some of the more life threatening type of disorders that may be associated with voice problem. For example, it might be a laryngeal cancer, that is a cancer or a tumor in your voice box, or it can be a respiratory cancer. So any of the cancers or tumors also might have change in voice as their first indication. So that also can lead to a voice problem. Generally, you might see that screaming, yelling, talking for a long period of time, using your voice in an inappropriate way. That is, you're straining your voice to sound like someone, imitate someone, or while singing, generally it happens. We try to sing with the tone of the instruments rather than singing in our pitch. So these are some of the most common causes that can be there. And another common cause that is generally or overseen by us is acidity. So
Exactly.
generally, people who suffer from acidity as well, that can lead to a damage to your vocal folds temporarily, permanently, which may need short-term or long-term treatment. So that also can lead to voice disorder.
Yeah, exactly. Actually, recently we were investigating a woman. She is a homemaker in her early 50s. So, on investigating it on stroboscopy, we found that she had a hemorrhage. So, and after the stroboscopy was done, we were asking her more questions related to her menstrual cycles actually. And then we figured out that the hemorrhage would have happened before, few days before her periods started. So, can you do you have you come across any such cases where this menstrual cycle, your menopause or PCOD, such things can affect the voice in any chance?
So even if you look at the general menstrual cycle or what we call as periods in women, it leads to changes in our hormones. But there are certain hormones that give us that feminine voice. When during the cycle, those hormones are at a lower level, which we call estrogens are at a lower level, you might see that your voice becomes a bit low pitch, and then you find it difficult to speak for a long duration of time. You get tired very
Yeah.
fast. And during these periods of time, when you try to strain your voice and speak a lot, then like this, it might happen that you might see there is a hemorrhage, or the person might have voice problems which continue for a week or so, especially if they are like professional voice users like teachers or actors. Or it can also be in a homemaker, because even if she's at home, she's not using her voice for a profession, she may need to use her voice a lot for maybe disciplining her child, or
Exactly.
maybe when she's speaking to someone elder in the house, so she has to speak a little louder, things
Yeah.
like that. Or generally, as we say, talkativeness can be a
Yes,
reason.
exactly.
So speaking over phone for a long period of time, that also can lead to such problems.
Mm.
But generally, whenever there is a hormonal fluctuation in the normal cycle of the women itself, or due to some major disorders like polycystic ovarian syndrome, PCOS, or even during pregnancy, post pregnancy. Anytime during these phases of life, women have excessive imbalance in their hormones, that also can lead to voice problems which become evident.
Yes. Like we were talking about children. So in children, you told yelling and screaming can result in voice problem. Is there anything else which children or the adolescents group can face voice related to voice?
So again, generally children are more involved in physical activities. So like how you take part in a lot of play or running around, your body muscles become tired. At the same time, your vocal muscles, your vocal folds also become tired. But irrespective of having a tired vocal fold, irrespective of having a fatigue, the child might continue to scream. They might just sing around and run around the house. Or many a times, children, the pediatric population, they may be having a lot of respiratory problems because of tonsillitis, adenoiditis,
Yes.
and that frequent infection can also lead to a voice problem in them. Adolescence, uh, you can take into picture right now what's happening. IPL is going on. So during sports activities, even if you are not a sports person shouting over the field, you might
Mm.
be a sports enthusiast or a viewer who gets excited and screams loudly whenever your team wins or loses, right?
Yeah.
So those things, or going to karaoke night,
Yeah.
singing with the karaoke, going to cultural fest, going to college sports events. So
Exactly.
these things are India, weddings,
Yeah.
any of the functions. So all these places are noisy,
Yes.
and when there is a noise present, you tend to speak over the voice. You try to
Yes.
speak
Yes.
loudly.
Yes.
So that also leads to a lot of damage to voice in any age group, but
Yes.
mostly in this younger category.
Yeah, as you correctly suggested, noisy environment. So even noisy environment can result in voice problems. So people who are working in heavy traffic or in factories, they also tend to speak very loudly, and that can again result in voice problem in those population. Okay. So next we'll move on to common signs and symptoms. So what kind of sign and symptoms we get to see in voice disorder patients?
So as just now, whatever we spoke, so whenever the all these excessive voice use or inappropriate voice use, so basically it has to continue for some time. They have this practice for some time, and then they start to notice certain changes in their voice. So these changes does occur in many of us actually, but whether you take care of it or not is the thing. It's
Okay.
a factor.
Okay.
So the common signs that we can see are maybe a slight change in the voice. Your voice, maybe your relative might say that your voice seems slightly different now.
Mm.
Maybe, are you having a cold? You get this question very often, maybe in a week or for a longer period, more than that.
Yeah.
So this is one common indication to somebody to just realize that it might be something wrong with my voice.
Yeah.
Then another common symptom that we see is that there may be a lot of breaks in the voice actually.
Okay.
So the person would be, maybe for example, as Bennett had said, the teachers are a very common population who encounter voice problems. So they
Yes.
take maybe 4 hours in a day or 8 hours in a day. So
Mm.
they have to speak continuously to their students. So during this process of continuous speaking, they're going to have some breaks.
Okay.
So they experience frequent breaks of their voice.
Mm.
They feel like their voice is tired.
Yeah.
So they speak for a half an hour session or a 1 hour class. They are tired as if they did some very exhausting activity. So that's called as a vocal fatigue,
Yes.
that a tiring of the voice. So
Mm.
these are the common symptoms that we see in them
Mm.
in any general public. So the first primary symptom which can be seen is a change in the voice.
Yes. So, do you think the professional voice users, the people who are singers or theater artists, will they come up with some different symptoms compared to, like, suppose a homemaker is coming with the voice problem, compared to that if a professional voice user is coming to you with the voice complaint? So, what kind of symptoms will be different in these two population?
So professional voice user, like as you said the term professional voice user, so they are a group of people who are going to use their voice in its most perfect form actually
Okay.
for excelling in their profession. So basically we can just break it down like that. So that means they are going to use their voice on a regular basis for most of their professional activities like singing, maybe acting, dubbing artist. And these days a lot of people enter into radio jockey, so
Mhm.
such jobs also. So these are all can be considered as a professional voice users. Now for them, maintaining their the same characteristic of the voice that they have, that has to be maintained on a long run. They should be able to do the similar kind of activity for a longer run. So there
Okay.
has to be improvement in their activity, their professional voice use.
Mm.
Now they will be able to detect a minute change in their voice also.
Okay.
So like for example, a singer who may slightly experience that I cannot reach my higher, but or maybe I am unable to reach the lowest notes. So these may be the common things that they realize, which maybe a common man, a teacher or a homemaker or anyone else, they may not be able to realize this.
Yeah.
Now say for example actors,
Mm.
or maybe dubbing artists or theater performers, they will have to utilize their loudness a lot to convey the feelings, emotions of their characters. So this difficulty in modulating their loudness, that also can be a earliest symptom that they can detect. And one more most commonly seen problem that they report to us is that their breath support.
Okay.
So they consider their breath support to be the most important thing. They work on it,
Mm.
but somehow they feel that currently I'm unable to sustain my breath for the singing or for the performances that I could do before.
Before,
So
exactly.
they are a group who can detect these problems very quickly.
Mm.
So this makes them, like, that's why we call them as professional voice users and try to address their problems specifically also.
Yeah. Another sign which we observe is throat clearing.
Yeah.
So, can you elaborate on that?
So I did not include throat clearing when I was telling the symptom, because many a times our patients come to us, they tell that my voice is not the same as before, or I have a change in my voice since 6 months or maybe last 1 year. So they come with different profiles. But while they are telling about all their issues, they'll keep doing this. So this is called as a throat clearing.
Yes.
So they keep doing this, maybe. So in the half an hour interaction that I have, or any of us have, they're going to, I can easily say that all of us would have seen people who might do it for like 5 times in half an hour, or even more than that.
Yeah.
So each time, so this, they consider it to be a very normal behavior. They are thinking that they are going to um, ease out all the problems that they are having as they are doing this.
Yeah. Exactly.
Okay, so that's what we can see. So
Hmm.
they don't consider it as a problem, but rather this is actually a it's kind of sign that our vocal mechanism is showing us that, or it's kind of a behavior that they are trying to do. So when they do this, they're excessively moving their vocal fold. So we have two vocal folds. They are moving their vocal fold excessively with a greater force.
Yeah.
So the movement which has to be very smooth, it's becoming more abrupt
Yeah.
and very rough.
Yes.
So each time you do this rough movement. So one time, 2 times. So imagine I said the patients did it like 5 times in half an hour or even more than that.
Yeah.
So it's actually more harmful than actually what they think.
Exactly. So, from there, the harmful practices. So, like how you told, throat clearing can be a harmful
Yes.
practices. So, usually we Indians, we usually don't go to doctor when we have some problem. We try to do some home remedy or something. But actually, sometimes those practices can be harmful for the patient. So, can you elaborate something on that?
Yeah. So as I told previously, generally when we have a change in our voice, we are prone to think that, oh, I may have a throat irritation, I have a throat infection. So general practices that we do: drink hot water, actual hot water, not even warm water or like room temperature water, or we might take excessively hot coffee, hot tea, or another thing is like eating some medications. Over the counter medications are easily available in India. So
Yeah.
we think that, oh, last time I had a cold or a sore throat,
Yeah.
this is similar to that, so let me take the same medication, right? Or maybe taking very hot steam multiple times a day just to relieve the symptom that I'm having, that is throat irritation. So what we should understand is the change in voice and the irritation in your throat may actually be due to a infection or an
Yeah.
inflammation.
Yeah.
In those conditions, yes, these things may relieve the symptoms. But just now, like how Akila told, it might be a throat clearing behavior that you're having because your vocal folds or your larynx is getting irritated, your voice box is getting irritated by acidity.
Yeah.
So
Exactly.
now the problem is in your stomach or at the level of your larynx where the acids are reacting and leading to an irritation. It's not an infection or an inflammation.
Exactly.
So
Exactly.
then when you try to treat it with these home remedies,
Hmm.
that can lead to an adverse effect. You are just prolonging the duration of the disorder if you
Yes.
don't get help soon.
Mm.
Then other things that we generally see is like drinking masala tea, which is very strong. That again increases your acidity, or like turmeric milk, or something like that, some remedies like that, or again some medications that are randomly taken. So what we should also know is that certain medications, coffee, tea, hot water, dust around us, all these plus smoking, alcohol intake,
Alcohol. Yeah.
all these have the function of dehydrating our body.
Exactly.
So, like how any machinery that has to work, that needs oil to keep it functioning, to lubricate it,
Lubricated.
same way our vocal folds are two tiny muscles that are like vibrating or moving at a very fast rate. So to keep them in a normal good functioning or to maintain their normal functioning, we are supposed to keep them hydrated. The water that we drink is supposed to give it that help, extra comfort to continue with the voice. But these all home remedies that we do, it may lead to dehydration instead of actually helping with the voice problem. Then, as I said in the causes, your voice change might be an initial symptom of something which is more serious problem, like I told, laryngeal cancer, or it can be due to you might feel that your voice is becoming softer and softer day by day or over a period of time. It might be an indication that you are having a neural problem, because of which you are not having enough breath support or not able to phonate loudly. So there might be an actual major disorder which is there, of which this is just a symptom. Same way, thyroid.
Yeah,
An
exactly.
enlargement of the thyroid, malfunction of the thyroid glands, that also can lead to your voice problem, right? So that's why instead of like diving into the world of home remedies and trying to correct it by ourselves, as Akhil had told earlier, if you see that your symptoms are prolonging over more than 7 days,
Yeah.
minimum consider it, make it a point that you get some sort of actual help.
Yeah.
That is required.
So from there, I will go to Akhila. So what kind of help they can get? So whom to approach? And after approaching the doctor also, like she told, home remedies people do, but not home remedies. What kind of precautions they can take?
Yes. So, as we are discussing about this, the main thing that people or any of us, so we are also professional voice users. Sometime we also might feel these issues or encounter these issues. So when we start to feel the problem, be it a professional voice user or be it anyone else who encounters these issues, slight change in the voice, breaks in the voice, and things like that, the best thing that they can do is not to get the problems worsened.
Exactly.
So go meet a professional, get the appropriate professional advice. So whom they can approach, so at least make a visit to the nearest ENT doctor, an ENT surgeon, find a voice therapist, so who may be also called as a speech language pathologist. Okay, so these days speech language pathologists are available in most of the places.
Yes.
So consult a ENT doctor and a speech language pathologist who is going to help
Exactly.
you identify what the problem is. So they, if at all, as Bennett had said, there may be multiple causes, so which would need investigations. So we
Exactly.
cannot just sit at home or just Google search and then interpret that this might be my problem.
Exactly. Yeah.
So we need further investigations also to find out what exactly is the problem that anyone is facing. So getting the best or the accurate diagnosis is the most important step.
Yes.
So that's something that anyone should be doing.
Okay. So, but what kind of preventive measures they can take, like which will not actually aggravate the problem in their voice?
Okay. So I would say that maybe preventive mechanism. So the first thing, if you are experiencing any of these problems, definitely you have to get a professional advice.
Yes.
That is the first way to prevent worsening of the problem. So that itself is kind of a preventive mechanism.
Yes.
Okay. So as we all know, like prevention is
better than cure.
better than cure. So
Yeah.
that's worsening of the problem than making it a serious condition. Get the appropriate treatment. Now there may be certain precautions that maybe any of us can take, like if you are a professional voice user. So basically they may be the group who will be actively looking forward as to how to preserve or how to prevent any issues in their voice, preserve their voice, and have their voice in their maximum capacity.
Yes.
So those individuals, so one of the most important thing is have their lifestyle in the most healthy way.
Yeah, healthy lifestyle.
Yeah, healthy lifestyle is something. Have nutritious food, maintain a healthy, balanced diet, and exercising. So all the habits that we take care to maintain a healthy life, those should be the first practice.
Okay.
hydration is something that's very, very important.
Okay.
So we have to maintain the adequate hydration to our body. So
Mm.
as Bennett said, like our body, the muscles are all moving.
Yeah.
So vocal folds, there are tiny muscles. All of those needs movement. So for the movement, lubrication is a very important factor.
Yes.
So how do we get lubrication? It's not just we can pour some oil or something.
Yeah.
We have to have adequate water,
Water.
hydrate ourselves.
Yes.
So which is according to the age. So there
Mm.
are age related considerations for the consumption of water, as
Yeah.
well as think about your associated problems, like
Problems. Yes.
you have a cardiac issue or you have a
Kidney related
related
issue.
issues.
Yes.
Yes, urinary related issues. So find out the associated condition and have the best amount of water that is required to support your hydration level.
So again, seek a professional help.
Yes.
So
And one thing that I think we should emphasize is, if you are a professional voice user, so or anyone who would want to take care of voice and prevent these issues, best is these methods can be whatever I said are more general statements actually.
yeah.
So there may be specific needs. As I said, somebody might have an associated illness. So in that case, the factors that they should follow in the diet, in the water intake might be slightly different.
Yes.
So get the advice, get a consultation, and then you figure out what's best for you.
Yes.
So these are some ways which we can do. And whenever if it's a professional voice user, now when they sing for a long time or when they speak for a long time, get adequate break.
Yes.
So these days all of us practice like you have to take a quick nap to get yourself refreshed. Your brain is going to be active. So you have such practices these days. Similarly, your vocal folds, it's tired, give it a break after 1 hour session of speaking or singing.
Yes.
Just maybe 2 to 3 minutes or 5 minutes of gap, a rest, which we can say a nap to your vocal folds. So that's something that will help.
Yes. So now we understood whom to approach. So when we approach them, how they are going to help us?
So when we come to the treatment part of voice disorders, again, I can't elaborate on it a lot, but in general, if I try to explain it, if it is actually some anatomical, some structural problems are there, or something is obstructing your voice from coming out, like I told, it might be a tumor, or it might be a severe neural issue, anything like that, if it is present, then there are chances that surgery may be required. But it might be for a very few number of our patients who have voice problems. But if it is a life-threatening situation or if it is urgent, so again, one more thing that everyone should know is that your voice box is not responsible only for the voice production. It is a valve or it's a gateway for your breathing. So if anything goes wrong over there, even your breathing can get affected, and the other way around. Breathing gets affected, your voice gets affected. So in that situation, that would be the priority. Yes. Rather than your voice. So surgery may be an option in few of the cases, in few of the causes. Many a times, medication might be the remedy that's given by the ENT or by the physician. So like we told, any form of throat laryngeal infection, inflammation, yes. Or maybe you have a lot of acidity, you are having a cold or a breathing problem. So during these situations, medications can be given. Yeah. And there are a few other causes also for which medicines might reduce the effect on your vocal symptoms. Yes. But generally, if you are having symptoms for a prolonged period of time, and in majority of the cases with voice disorder, voice therapy can help you a lot as a treatment as well as a preventive measure. So like Akila told, if you are a professional voice user, you want to keep your voice at the best. Same way how a sports person, an athlete will do their exercises every day, warm-ups every day. A coach will be training them, even though they are participating since many years. Yes. So in the same way, a training is required for your voice as well, if you are going to be a professional voice user. So in that case, voice therapy would be beneficial, or a vocal coach might be helpful for you. Okay. So majority of the cases, I think voice therapy does help, Again, based on what symptoms you have, based on from how long you have the problem, and what is the underlying cause, you may have to vary.
Okay. So, voice therapy, can you just elaborate a little for our viewers? Like they might think it might be an invasive procedure, or is it like a medicine?
Okay.
So,
So voice therapy generally, it's a non-invasive procedure. We are not going to give you medications. Like I told, it's more like we are giving training to your voice box, which we call as larynx, so that it can function effectively along with your respiratory mechanism, your breathing, and overall speech. So basically, three things might be recommended to you when you approach a voice therapist based on your current condition. So one can be temporary or complete voice rest, so modified voice rest or a complete voice rest, wherein to how if you are tired, you need to rest your body for a few days, or you undergo a surgery, you need to take rest.
yes.
Same way, after voice surgeries or after excessive trauma to your vocal folds, you may be asked to take voice rest. Second set would be of recommendation would be like how Akila told, we make a profile of what are the habits or what are the factors that are affecting your voice related to your profession, your lifestyle, and all that. And we will try to train you how to stop being in that harmful practices.
Exactly.
So we are trying to reduce the further damage to your voice. And the third set of things that comes is the voice exercises. So the voice exercises are simple training exercises which we give to help you balance the way or to get the most effective production of voice from you without straining your voice, without straining your system.
Okay.
So that is in general what is being done. So it is
Yes.
nothing to do with like instruments being inserted or medications being given.
Yes.
Many
Purely
of us,
therapy.
our patients will ask us,
Yeah.
do you have some pill?
Pill.
Do
Yeah.
you have some small tablet
Yeah.
which I can just
Yeah.
swallow?
Yes, exactly. Oh God. So with this, actually, we have come to the end of our discussion, actually. So I want a take-home message from each of you. What take-home message you will give to our viewers?
Okay. So on this Voice Day, that is April 16th, so one thing that I would like to emphasize is that many of us are professional voice users. So earlier it was only the singers who may be considered. So now we have a lot of professions who rely on their voice. So one point that I would like to emphasize is that take the best care of your voice. Find out what's best for your body to get your voice into its maximum potential so that you're able to use the voice for a longer period of time in your life, uh, it to its maximum also. So, and also take the appropriate professional advice. So I always believe that for a professional voice user like singer or an artist, it's very important to have a trainer or a therapist who will help them to find out what are the best in their voice and how they can improve on certain behaviors or certain factors which will help them improve their overall potential also.
Yes, exactly.
So come out of their, so it might even help them come out of their comfort zone, try out new ventures, so which might be possible when they have a coach who will help them optimize their voice.
Yes, exactly. Thank you, Akila. Bennett.
So I would like to say that, okay, Akila told it from the point of view of professional voice users, but even if you are not a professional voice user, a voice disorder is a problem which is present in your body. It's like any other illness or sickness that you have. So don't ignore it. Like I told, it may be just restricted to your voice box or to your vocal folds, but there is a chance that there is something a different disorder that's underlying, which is causing this change in your voice. So it's very important for you to not ignore it, to not just take multiple home remedies or over the counter medications to try to resolve the problem. It's always best that you pay attention to how your voice changes, for how long it's changing, and then like we told, either follow the preventive measures that are required or seek professional help, which is mostly required. So, always best if you have symptoms that are persisting beyond a week or two, always go and consult an ENT specialist, or you can go to a voice therapist. Visiting both is the best practice, because if it requires medical or surgical intervention, the ENT specialist will be handling it. Whereas if it requires more of like training your voice to function better, the voice therapist would be helping you with that.
Yeah, so great. So do take good care of your voice, seek professional help, stay healthy, stay safe, follow a good lifestyle. And still, if you have voice problem, you can check the description box. You will find our address and you can come visit us. So, with this, we have come to the end of the program. I would like to thank Nitte deemed to be University, Nitte Institute of Speech and Hearing, and Nitte Institute of Communication for helping us to create awareness regarding World Voice Day and voice care. Signing off for now. Thank you.